Hello, this is Krista Winston, and I will be talking about the opt-out sickness, opt-in care, comprehensive hepatitis C health education intervention and prevention program for baby boomers and generations X and Y. My program description is about opt-out sickness and opt-in care, which basically is a health education, intervention, and prevention program. It's designed to increase the rates of hepatitis C, HCV, screenings in two particular groups, disproportionately affected, identified by the Centers for Disease Control and Prevention. The first group is our baby boomer group. The CDC classified persons born between the years of 1945 and 1965, give or take a couple of years, as the baby boomer generation. And the other group will be the Gen X and Gen Y, generations X and Y that overlap. So there will be the Generation X, 1966 to 1979, those born between those years. And then our Generation Y, which will be persons born between 1979 and 1995, as according to the CDC. The population will focus on groups identified by the Chicago Department of Public Health's 2016 surveillance report. So what does that mean? Basically, it means as of 2018, a baby boomer would be about 54 to 74 years of age. And again, these numbers, these ages, give or take a couple of years before or a couple of years after those targeted ages. As of 2018, a Generation X person would be between the ages of 39 to 52, and then as of 2018, a Generation Y person would be between the ages of 23 and 38. And basically, generations are categorized as people who share the same group of characteristics between a group of ages. And that's kind of what makes them get a generation name, like baby boomer, Gen X, Gen Y, or millennials. So what is hepatitis? Hepatitis is a medical condition that causes inflammation of the liver. The liver is an organ essentially used to help with digestion of food, but most importantly, rids the body of toxic substances. Over time, an unhealthy liver can cause the body several complications, including severe illness and even death. And as you can see here, this is what a healthy liver would look like. It's very tangible, very flexible, sort of like a cow liver, something that is very red and vibrant. And over time, if liver is affected, we start to get to where the liver hardens and stiffens until you get to a cirrhosis, very hard liver, where the liver necessarily is not functioning because it cannot, certain toxins cannot get through it because of its stiffness. The four types of hepatitis will be autoimmune, which is something that the body's liver is actually attacking its own liver and the functions. Hepatitis A, which is a virus that clears on its own, usually found in infected persons or infected feces. Hepatitis B, another blood-borne, usually contracted through sex or needle sharing. And then hepatitis C, also blood-borne, usually contracted through blood and then sex. A little bit about hepatitis C facts. 2.4 million people are living with HCV. This number is actually down from about 3 million a couple of years ago. It's again transmitted through blood contact, sharing of needles, using or receiving blood products infected with HCV, which could be tattoos, razors, piercings. If you share needles, diabetic needles, all of those are any type of blood-to-blood contact. Mother-to-child transmission, even though that doesn't happen as much anymore. And then sexual contact. Those are always all ways of transmission Sexual contact being the lowest way of transmission, but it is partly for a lot of people the way that they receive HCV when they are not considering that they've had any kind of on the surface blood contact. They will contribute their exposure to possible having sex with partners who were hepatitis C positive. Most people will die from HCV complications more than HIV. And that is from the CDC, that because HCV right now is the most infectious disease in the US. So the opt-out sickness, opt-in care, our population needs are, again, baby boomers. They were mostly infected during their 30s and 40s. They were disproportionately affected because universal precautions were not mandatory until 1992. Most were unaware of their status. Most didn't even know they had it. The symptoms for HCV are very minor. They liken the flu. So many people did not even know that they were infected during the times of the 70s through the 80s, when hepatitis C was at its most rampant, the infection rate. So they recommended in 2012, the CDC recommended that HCV screenings for all baby boomers due to this information about them being disproportionately affected during those years. And universal precautions basically means wearing gloves at all time when handling blood or blood products. Different organizations like hospitals, healthcare workers, nail technicians, using gloves across the board would be considered universal precautions. Testing blood for HIV and hepatitis, although they started testing blood products for blood transfusions in 1987 for HIV, they did not mandatorily check blood for hepatitis until 1992. Generation X and Y are a little different because they had the highest rate between 2005 and 2016 of an acute exposure, which means that many people are becoming exposed to hepatitis C, although that they may not have the chronic illness. Whatever behaviors that are contributing to them being exposed to hepatitis C have grown in these past years. The increase from 2012 to 2016 is largely contributed to the opioid crisis related more to IV drug use. And they have now said that white males in generations X and Y are the leading population in the increase of HCV diagnosis between the years of 2012 and 2016. The behavioral models that we're going to be using, along with partnerships with HepCat and CDPH, is basically the intervention mapping, which will allow baby boomers that are identified from their medical records to have an opt-out screening prompt for hepatitis added to their medical record, so that when they come in for routine laboratory work, that opt-out consent will be presented to them, and then the flag will pop up in their medical record so that they can be identified as someone who needs a hepatitis screening, which will catch any form of hepatitis that they may have been exposed to. The social marketing behavior model for our Gen X and Gen Y, while they will also have a routine prompt in their medical record, because they may or may not be part of the clinics that we will be working with. They may be part of a night ministry or different or community-based organizations. They will have a routine screening, and we will use the text-to-text follow-up social marketing